We move to Alzheimer's disease now. It's likely you've known someone impacted by the brain disorder that attacks memory and thinking skills. According to the Alzheimer's Association, about 1 in 9 Americans age 65 and older has Alzheimer's, and that among the 50 states, Nevada is one of the fastest growing in terms of Alzheimer's disease populations. A 30% increase in Alzheimer's patients is expected in our state by 2025. Those statistics further highlight the importance of a partnership between UNLV and Cleveland Clinic, Nevada. A National Institutes of Health grant made the partnership possible in 2015, and now a recent grant extension will allow the two groups to continue building upon their Alzheimer's research. Joining us to talk about what's been accomplished and what hope there is for Alzheimer's patients is Dr. Aaron Ritter, staff neuropsychiatrist at Cleveland Clinic, Nevada, and Jefferson Kinney, founding chair of the Department of Brain Health at UNLV. Gentlemen, thank you so much for being here. I want to start with you, Dr. Ritter. Nevada, one of the fastest growing states with Alzheimer's disease population. Why?
Well, the biggest risk for Alzheimer's is age. And the great thing about Nevada, it's got great weather, so people are moving here, but they're moving here at a time when we have an elderly population. So that's why we're seeing a lot more cases of Alzheimer's disease, just a common disease that happens after the age of 65. And so our center and UNLV, it's a commitment to the community to better care for people with Alzheimer's disease. So we're really excited about this grant and this opportunity to continue to advance the science of Alzheimer's.
And Jeff, I think I said Jefferson earlier, but
Yeah.
You said I could call you Jeff.
Absolutely.
Since the start of this partnership, what have you accomplished? What's most notable? And then what do you want to accomplish in phase 2?
So it's a really good question, and there have been a lot of accomplishments in the project. So these grants are designed to not only foster research and also foster patient care, but also to help develop the next generation of researchers to continue to expand on the research. So we've had a number of investigations as part of the first phase of this grant that have led to some really interesting novel discoveries about differences between men and women in Alzheimer's disease. There have been some basic research advances about new mechanisms that may be driving the disease. And probably most noteworthy is we have created a very strong, well-characterized cohort that is used for a lot of these studies. So we have members from the community who are invested in part of the projects with us. And what we collect in these projects is data that advances our understanding of the research. So as we move into this second phase, the real opportunities is to continue the growth that we've had, to really drive new science and new discoveries, and also really have an impact in Southern Nevada for patient care.
I understand biomarkers is something you're
Yes.
after. What is that and how will that
Yeah,
help?
we've managed in the first part of this grant to develop a biomarker laboratory that allows us to look at blood samples from patients to look for markers of the disease. And these are really a needed thing in Alzheimer's disease research, the ability from a blood sample to do a test, and I think we're very close to this, to test for a good predictor that the disease is coming, because that means you can start to intervene earlier, you can understand the disease earlier. And these biomarkers can also be used to tell whether or not new treatments are being effective in patients that have the disease. So we have built this very large framework to do a fairly unique model of evaluating patient samples that come from our clinical cohort for us to both examine existing biomarkers that others develop, but also generate brand new ones here in Nevada.
Dr. Ritter, back to the specifics of this grant. It is the Center for Biomedical Research Excellence Award, and it's specifically meant to benefit historically underfunded states.
Yeah.
Why is Nevada underfunded, and why should it not be? What makes this population here unique and beneficial to your research?
Yeah, so anybody that's lived in Nevada long enough knows that a lot of times in the past we've had to go to California or New York or Seattle to participate in groundbreaking research, and that's just been the reality. It's kind of the way the medical community has evolved, that we're bringing grant work here, we're bringing scientists here, new scientists. We're collaborating with a brand new School of Medicine, a brand new Department of Brain Health at UNLV. The Ruvo Center, it's 10 years old. That's all it's been here. And so we're wanting to bring the science here because that's where the patients are. That's where the people of Nevada are very interested in advancing the science of Alzheimer's disease. And so we have the patients, now we have the scientists, and we have the science to be able to make some real big strides in understanding this disease.
And what about the socioeconomic makeup of the population here? And you're also going out into rural communities, correct?
Absolutely. So historically, Alzheimer's disease research has been done in big cities with this kind of very homogeneous patient population. And that's not right. And our goal is to reflect sort of the great diversity of the state of Nevada. We have people that come from all over the world to be in this great city that we have. And so we want to be able to reflect who actually gets the disease, because this is a disease that is prevalent all over the world. We don't know why people get it, but people get it in China, they get it in Africa, they get it in Australia, they get it in the United States. And to be able to understand those differences that may be contributing to the disease. So our goal is to enroll people that look like our neighbors and our community members. So that's also the nice thing about bringing a grant here to the state and to involve the big players in the city.
You mentioned we don't know why people get it,
Yeah.
but people from all over the world get it. What is the cause of Alzheimer's?
I wish we could actually give you the answer, right? So this is one of the largest questions in this disease, and there has been tremendous progress for decades now. We are learning more and more every year. Our group, other groups are really advancing the basic biology understanding, but also the things that contribute to it. This includes, there are risk factors that make someone more likely to develop Alzheimer's disease, and trying to understand that association. There's the core pathologies of the disease that we are still trying to decode, but the advances are moving fairly quickly, and this is also translating into new treatments being developed fairly quickly.
How long has the idea existed that the cause of Alzheimer's is related to plaque buildup of proteins in the
Since
brain?
the very first doctor that described this, Dr. Alzheimer, 1908. So he was able to, one of his patients, he was able to secure the ability to do an autopsy, and he saw these plaques and tangles. That's still what we're talking about with Alzheimer's disease research. So it's been 100 years, we've made some advances, we kind of understand what these plaques and tangles are and what the potential genetic components are, but we don't know why they accumulate. And we see patients all the time at the Ruvo Center that have no family history, and they may develop the disease even early on, and we have no idea why that's the case. So it has to be something in the environment, it has to be something in the brain's internal environment that predisposes people to the disease. I think there's a misconception that this is a genetic disease, because there is a genetic form of Alzheimer's that doesn't skip generations. But for 95% of the population, the risk is age. And everybody that plans to live over the age of 65 is at risk for this disease. Age is the #1 risk factor.
So you go back to, in addition to age, the plaque buildup, and you think, let's get rid of that plaque buildup, which is what drugs are currently doing. There was a drug, Aduhelm, approved by the FDA, that did just that, but then in one trial it showed it had no real impact on improving memory, preserving memory. Another trial didn't work at all. Medicare is not going to cover it for most people. Also, the Cleveland Clinic is not going to prescribe it. So why?
It's a difficult question to answer. So we know that these plaques have a role in the disease, because that's what the genetic version of the disease is. You develop these plaques at a higher rate, and those people get Alzheimer's disease, the familial version. So these plaques have a role. Now we have a technology that can clear the brain from these plaques. And in a trial of a year and a half, it didn't demonstrate the benefit we'd like to see clinically. It's hard to show benefit in Alzheimer's disease, which is a chronic disease, in 1 year. But we have a technology now that can clear these plaques from the brain. That's a huge breakthrough. That's a step forward for the field. Whether or not it's the right prescription or medication for everybody right now, I think that's the question that we're wrestling with at the Cleveland Clinic. That's the question that CMS is wrestling with, and that's the question the FDA is continuing to wrestle with. And so it's still a nice breakthrough for the field, but I think the point is we need to understand this medicine a little bit better and to definitively prove who this could be helpful for, because it doesn't help everybody, but there's some people that are helped by this medicine. That's what the data seems to show. And so we really need more research.
Yeah, I think it's really also worth pointing out that this is the first of many, right? So progress is by all means the first largest priority. So This drug shows some promise, but there are several other in the pipeline similar to it. There are also a number of other medications that target different aspects of Alzheimer's disease that are also in the pipeline. So as long as the work is progressing forward, this is a breakthrough because it's been since 2003, I think was the last FDA-approved treatment for Alzheimer's disease. This is a big step forward. Now the goal is for all the other ones in the pipeline to develop and also to figure out how best to use this one and the other ones that are in development.
But then you go back to the idea that perhaps the plaque buildup is not what's causing Alzheimer's.
Well, so
and there are other hypotheses being floated around as the cause, as a result.
There absolutely are, and what I think is a really important thing to point out here is that how much the plaque is causative in the disease is 20 years ago was probably a larger proportion than what is thought these days. The greatest breakthroughs in Alzheimer's disease research of the last 20 years has been that the field has started to diversify. So groups are chasing the plaques, groups are chasing the tangles. There are research projects, some of the research within my group is on inflammation in the brain, and it drives some of the Alzheimer's pathology. So what we're really starting to learn is this is a complex ensemble of pathologies that gives rise to Alzheimer's disease, and that there may be some variations in it. So rather than focusing on a singular feature, the idea is to look at all of the possible mechanisms, and that's where the greatest advances have come, especially in the last 10 years, of how we are advancing a more diverse series of mechanisms.
Dr. Ritter, I want to make sure you talk about the importance of having people come and participate in what you're doing in order to find a cure.
Well, anybody that's ever had a family member with this disease knows that the treatments we have right now, they're not going to cut it, especially with the rates increasing. And that's because people are living longer. We have better medications for your heart, for your lungs, for HIV, for cancer. And so people are living longer. That's a great thing. But now we need to be able to translate that long life into long brain life. And so we need to be able to advance the science, to continue to do that. And we don't do that without participants in research studies. And so we have over 200 people that are participating in our study. We're grateful to them. We've been following some of them for 7 years. They come in every year, do a brain scan, they're getting blood drawn. And there's a lot of people that have contributed in the Valley that can now contribute to Alzheimer's disease research, and we're grateful for them. And they're helping us advance our science. We had 10 people that participated in the aducanumab study here. They've advanced our science. And so we're hopeful that we can continue to do experimental research here in the state. And that the next treatments are better, and we get to the point where we can actually really help patients. This is a starting point. I think this medication is something that we're very excited about. Well, even if this gets approved and it gets available to the general population, we want to stop it before the symptoms start. I mean, that's really kind of the goal. And Aduhelm, at the best, it's going to keep people stable. I mean, at the very best. And we want to do that before the symptoms start, before things kind of go awry.
And just to clarify, Aduhelm and the
aducanumab, they're the same. There's the kind of same thing. One's the generic and one's the brand name. Yeah.
Gentlemen, thank you both so much for your time.
Thank you.
Thank you.